enemies, foreign and domestic. I'm checking the Constitution of the United States, trying to find this, and you have a quote from James Madison, the father of the Constitution. He says, "I cannot undertake to lay my finger on the article of the Constitution which granted the right to Congress of expending on objects of benevolence the money of their constituents." James Madison couldn't find the place where the Constitution gives Congress the power to give our money away. Since you're spending my money, our taxpayer money, on these objects of benevolence, James Madison couldn't find it in the Constitution of the United States. Where in the Constitution of the United States did you find it, since you voted to do just that?
Article 1, Section 8 says, Congress shall have the power to lay and collect taxes, duties, impose and excises, and pay the debts, and provide for the common defense and the general welfare of the United States.
General welfare.
Let's just be clear. It has the same provision that supports Social Security and Medicare. And if this plan is unconstitutional, then so is Medicare and Social Security. Okay, then there are people that believe
Support and defend the Constitution of the United States of America.
we're different in our interpretation of the Constitution. But to the extent that this plan is unconstitutional, so is funding for Social Security and Medicare.
Commitment to Social Security. 78%. That's what you're telling me.
That's the position that people are taking. But if you're going to make a constitutional argument, people need to know what the argument is. The argument is that Social Security and Medicare, and so is this. I disagree with that analysis.
And unfortunately, I'm going to tell you all a quick little story about my first year in grad school. So my COBRA ran out, and I can afford insurance. So going to class, have to go to the emergency room, and wasn't married at the time. So let's see, am I going to pay my rent or health insurance? So I chose to pay my rent. So I go to the emergency room. Mind you, I'm going into a life of public service. Go to the emergency room, get misdiagnosed because the doctor, he knew that I didn't have insurance, and he said, "Do you want to run all of these expensive tests that I know you're not going to be able to pay?" I said, "No, it'll be okay." I was hoping that I would be okay the next day. Had to go in overnight and get an emergency appendectomy. So I graduated in May with my master's in social work. Thank you. But I'm $70,000 in debt, plus my graduate school loan. So to all of you that think that this healthcare reform is not what this country needs, I just want to ask you, how do you think that is fair? How do you think that's fair?
Mike's not fair.